Goddesses, welcome to Minnow Labs Live. Since it's the month of love, I thought it would be great to talk about self-love, but for your lady parts. If you're in your 40s or above, many women start to experience nonstop UTIs, incontinence, or vaginal dryness. We want to get the answers for you so you don't have to delay getting the help you need. So we've got an expert here today from the Pelvic Floor Indigo Physio. I'm so excited to have this guest on today. And if you have any questions, make sure you get those into the comments so you can get them answered today. As always, this session should not be considered medical advice and is being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. But we're gonna get started now. My name is Natasha. I'm the community manager for Minnow Labs. So excited to have our brand partner, Dr. Maggie, with us today. As you see, she is an expert on every level. She was already answering questions before we even started. And then our guest today from Indigo Physio is Dr. McCaul Butcher. So happy to have you here with us today. What are we drinking today, ladies? How are we gonna get started?
I'm holding my warm jasmine green tea here.
Not as fun. I just have my good old-fashioned water.
Which is always so good. And I've got my rooibos tea, so I'm really enjoying because it's cold out here right now. So getting started there, ladies. Thank you so much for joining us and everybody who stayed with us. Last month, I had my first pelvic floor appointment over at Indigo Physio, and it was such an eye-opening experience. I learned so much about my body, and I left with homework to help with my symptoms, which we'll get more into that later in the show. But I can't wait to see how these exercises that I was given help my symptoms. So we'll look forward to that discussion a little later. But Dr. McCaul, many women may associate pelvic floor therapy with pregnancy and postpartum, but it can be really, really helpful during perimenopause and menopause. Can you please share what you guys are doing over at Indigo Physio?
Yes. So Indigo Physiotherapy is specialty physical therapy clinic. We have locations across Maryland and Northern Virginia. We were founded by Dr. Sam back in 2016. Our clinics, all of our therapists are extensively trained and certified in treating pelvic health, pelvic floor physical therapy across the lifespan. And so it's not just prenatal, postpartum, but really looking at how we can address some of these symptoms associated with perimenopause and menopause. So a wide range of pelvic floor issues can arise related to urinary symptoms, so stress incontinence, so leaking urine when you laugh, jump, run, urge incontinence, which is that strong feeling that you have to get to the bathroom, bowel concerns, so constipation, fecal urgency or lack of control of our bowels, all associated symptoms we can address, pelvic organ prolapse, so that feeling of a heaviness or pressure when some of those pelvic organs start to descend into the vaginal canal. And so sexual dysfunction, that's another really common symptom that we can address. And so, we say our phrase here is, yes, these symptoms are so common, but they're not normal, and patients shouldn't have to live with this. There's so much that can be done to help address these symptoms.
Very true. And Dr. Maggie, how can hormones affect these symptoms or these experiences in pelvic floor that Dr. McCaul just shared?
Right, yes. So there is this uptick of these pelvic floor symptoms during the menopausal journey, and it's really driven by the hormonal, majority is from the hormonal changes that are happening. So we have receptors for estrogen and testosterone all throughout our pelvic floor, in our urethra, our vulva, our bladder. And so when these hormones decline, our tissue and the strength of these pelvic floor organs, tissues get weaker. And so we're more like the urethra isn't as strong. So we're more likely to have, leakage when we don't want it. We could have more prolapse. We could have pain. So it really can be driven by the changes that happen as our hormonal levels decline.
And then Dr. Maggie, follow up for both of you, but Dr. Maggie, let's start with you. What can help with these symptoms, with these issues that women can experience in their pelvic floor?
Yeah, so of course, realizing, because so many people do normalize it. I'm so glad you said it, just because it's common. You know, like us, part of getting older, and it's like my pet peeve, and I'm glad you brought that up, Dr. McCaul. There are things you can do. So, you know, from my perspective, I will get people on the vaginal estrogen. That can be really, really critical as far as strengthening the pelvic floor and getting those hormones back in. There's also there's a particular suppository that's available that's DHEA, and that is considered an androgen. So your cells take that DHEA and convert it into estrogen and testosterone, because again, there's those androgen receptors too. So the hormonal, actually just giving it works locally, so just works in that pelvic floor area. And then I always refer to a pelvic floor physical therapist who are like the true experts in this.
Definitely. And then Dr. McCaul, then what would you recommend?
Yeah, so you know, again, it oftentimes we see a multifaceted approach. So having a provider that can, you know, prescribe some of these additional supplementations that are important, such as the estrogen cream that Dr. Maggie mentioned, and then finding a specialist, a physical therapist that has training and specialty in pelvic floor therapy. You know, it's not a one size fits all. And so, you know, we can give some general guidelines and recommendations, but it's really important to get started with someone that can really understand what the root of the problem is, from that, you know, more tissue and muscular standpoint, and what we can do to address that. So whether that's more stretching at first or strengthening those pelvic floor muscles, or sometimes it's a combination of the two. And then understanding how some of these other components, so sometimes it's looking at, okay, well, you know, maybe we need to see how your posture plays into it. You know, getting started on some other, we think of them as kind of the allies and the supporters to the pelvic floor. So your glutes, your core muscles, your back muscles. So really looking at the whole movement system and how it all converges and can support the pelvic floor. So really getting started with a specialist, a pelvic floor therapist, and then, you know, really leaning on our medical providers as well, to help target some of the other root to those issues.
And I love how the specialists can partner with our healthcare provider. Sorry, go ahead, Dr. Maggie.
No, absolutely. It's the integration of healthcare that leads to really the supportive team for everyone. I do want to say, just to put it out there, that there are also surgical options. Obviously, it's not like first line, but, you know, I don't think a lot of people know that, like, if these treatments, which are really effective for a majority of people, are not effective, there are also surgical options. I just wanted to throw that out there too.
That's really good.
That's a great point. Dr. Maggie, and I will say, from a physical therapy perspective, you know, even if we're getting started with physical therapy and we see that surgical intervention may be recommended or warranted, outcomes look really good when they're paired with physical therapy as well.
Yeah, it'd be essential. Definitely. Dr. Maggie, some women may experience urgency during perimenopause and menopause and then like restrict their liquid or water intake. But we know it's so beneficial to keep drinking all of your water. So I just want to do kind of a reminder. How much water should women be drinking during perimenopause and menopause, and how it can help like with their hot flashes and stuff?
Yeah, no, we want to stay hydrated. Yeah. In fact, it can be like worse for us, because if we're dehydrated, then our urine becomes more like acidic, and it can irritate our urethra even more. But I hear it all the time, people being really cognizant of like not drinking that much because they have a long car ride.
Yes.
So it's fine to be mindful, but no, we really do need to stay hydrated. It helps us with all the other symptoms that are going along at the same time as perimenopause, like the brain fog and fatigue are big ones. So I would say start your day well hydrated. You know, start your day, I would say, with 16 ounces of water before any coffee, before any tea. And then when you're done with that, you know, pour another 16 ounces and sip that throughout the morning. It's fine to taper at the end of the day. I think it's fine to be mindful of that so you're not waking. I don't want you to go to bed thirsty, but definitely start your day hydrated in the morning, sip throughout the day.
Yeah, I love that. Dr. McCaul, I've found this interesting when we talked about this. I was curious, you know, do most women think, or would you say that most women experience pelvic floor issues if and only if they've had children? So if they haven't had children, will they not experience pelvic floor issues?
I think that's a really, it's a common question we get
Yeah.
a lot, and also somewhat of a common misconception.
Yeah.
Every walking, living, breathing human being has a pelvic
Yeah.
floor. And so a lot of these pelvic floor related conditions don't discriminate. And as we discussed earlier, so much is driven by some of those change in hormones at this particular time in our lives for that perimenopause into menopause phase. And so whether you've had children or not, we can still see onset of these pelvic floor related conditions. So unfortunately, it doesn't discriminate and can really affect those, across the lifespan. But the good news is that there's so much that we can do to help and support these patients. There may be some, individuals who are, their symptoms may be kind of exacerbated or worsened, or there could be some kind of prognostic factors that if you've had more children kind of could lead to increased risk of some of these related conditions. But that's despite, not having children, you can still develop some of these pelvic floor related conditions.
So good to know. Dr. Maggie, you touched on this a little bit earlier. If women are experiencing, they're not having restful sleep and they're being woken up, some of them, by needing to go to the restroom. So I wanted to ask you ladies, what can help women get the sleep they need, sleep all night long, and not get woken up to have to go to the restroom?
Yeah.
If you want to touch on
it. I'll just say what I usually, I think I'm repeating myself, so I would love, Dr. McCaul, if you have anything new to add, but it's the pelvic floor support, right? We really do need to support that. So through the physical therapy, through the hormones, through the exercises, and then I think it's fair to taper your fluid intake before bed.
Yeah.
Not go to bed thirsty, but to just be mindful of the fluid intake right before bed.
And then there's different foods and fluids can be more irritating to the bladder. And so things like coffee, certain teas, caffeines, alcohol, acidic foods can be a bit more irritating. So especially if patients are consuming those in the evenings, we may want to consider reducing intake of those or trying to increase our water intake to help dilute that a little bit. And that's a big part of what we do in our sessions is we work with patients to look at what they are eating and drinking and try to determine, are there certain things that are maybe more irritating or aggravating to the bladder? And we can do it. We have patients often do a bladder diary, and we can really do a deep dive into what we think may be some contributors there, if there's anything in particular. And I always say, like, I don't like to tell patients that it's an all or nothing. We do our best to try to give you some tools to be successful and see where we can make some small adjustments. I love my coffee, so I'm not willing to give that up completely. But we know sometimes we need to make some small adjustments.
I do love tracking. We're always talking about tracking your symptoms, but I love that you're tracking the logging of your food and your drink intake, and then something that maybe you didn't notice was triggering could be doing it too. So I think that's really great information. Dr. Maggie, in the intro, I talked about how women during perimenopause and menopause might start experiencing a lot of frequent UTIs. And the first thing we usually think about when we think about UTIs is cranberry juice. I wanted to see if that's something that is effective. It's the best option for women when they're trying to fix their UTIs.
Yeah, certainly one of the most common ones we talk about. So cranberry juice can be effective. I mean, it has an ingredient in it that binds to gram-negative bacteria. So what that is are a particular strain of bacteria. The most common bacteria that leads to UTIs in menopause and actually overall is E. coli.
Yeah.
So it's a gram-negative bacteria, and there's this ingredient in cranberry juice that can bind to those gram-negative bacteria that then prevents that bacteria from binding to the bladder wall to urinate it out. So it can be effective. You just want to be careful because cranberry juice can be very high in sugar.
Yeah.
And that does not work.
No.
So unsweetened concentrated cranberry juice can be effective. I go to D-mannose, which is a supplement, and it does the same thing. It binds to those gram-negative bacteria and allows you to just flush it out with your urine rather than adhering to the bladder wall and causing an infection.
Yeah.
So yeah, cranberry juice can be helpful, but but it's not the only thing.
Yeah, that's
Yeah.
what's good to know. Let's jump into some options to help with the pelvic floor. I know that we're all a little scared about Depends, although they're not just Depends nowadays. I've been down the aisles and they have like Always and Honey Pot have incontinence pads, but there are other options, and we want to dive into those essentials for the pelvic floor health right now. Dr. Maggie, do women need to be on estrogen cream for the rest of their life if they've been prescribed it and it's working?
Yes, if they want to continue to get benefits, yes.
Yeah.
The thing about estrogen cream is it's, my mentor told me it's like flossing your teeth, but for the vagina. It's just maintenance care.
Yes.
And do it, it's twice a week. So it's not every day. And once you build up, if you miss a dose, you're not going to go right back to the starting point, but it is something you need to keep up for the rest of your life.
Yes. Dr. McCaul, there's been so much discussion around Kegels. Are we doing it right? Is it necessary anymore? Can you set the record straight?
Yes, Kegels. This is something we hear so often, and so the thing, Kegels are not. They're not always the starting point, and it's not always the answer. So Kegels can be a great exercise and an evidence-based way to strengthen the pelvic floor. But really, in some cases, so if it's more of a painful condition, like pain with intercourse, those muscles may have actually an increased level of tension, and we need to work on stretching and lengthening those muscles first. And so that's where, a pelvic floor physical therapist is going to have the tools to be able to assess what we think is some of the root cause to that, and prescribe whether that's stretches to start. Maybe we do need to do some Kegels to start, but it really just depends on the person and their complaints and their condition. But so simply stated, if you want to give it a try, you want to try to do a Kegel, it's really that feeling like you're trying to stop the flow of urine or stop from passing gas, although we don't want you trying to do this while you're actually on the toilet, but that same sensation. And then just as much as we want those muscles to contract and kind of pull and lift up, we want to make sure that those muscles can relax back down. And so we're taking those muscles through a full range of motion. So if you're feeling like you're having a hard time kind of feeling those muscles, connecting with those muscles, that's usually a good indicator that it might be worth getting assessed and making sure that, one, it's the right thing for you to do, and two, you're doing so correctly.
I remember they used to really encourage us doing it everywhere. Like if you were at the gas station putting in the gas, you would do it while you're standing there. Is that something you still think, like if it is something you should be doing, do it all the time? Or
so this kind of analogy is let's say you have shoulder pain or an issue with your shoulder, we're likely not going to have you go around doing hundreds and hundreds of shoulder exercises. So these are muscles that yes, they need to be strong and have good endurance, but it's also equally important for those muscles to be able to relax and lengthen. And so typically we give more of a prescription based off of what we find. It's a part of your routine, but we don't need to be doing hundreds throughout our day.
Good point. I love that. Okay, ladies, I would love to get a resource from you, a book or a website where women can learn more about pelvic floor health. We're all about education as empowerment. So I'd love for us to learn more about pelvic floor health somewhere. Dr. Maggie, you want to go first?
I think there's some good YouTube stations that I think that have some good pelvic floor physical therapists sharing information. Instagram, I know I wrote down the Vagina Whisperer, I think.
I follow her
resource.
too. Yeah.
She's on YouTube.
She has a book coming out too.
Oh, okay.
Yeah.
Okay, amazing. Yeah, I mean, there's so much information these days that are available. Of course, you want to tease through like what's, real versus not, but finding that trusted person. Dr. McCaul, do you have books that you recommend?
I would say there are some couple good ones. Again, some of it depends. You have to make sure it's from a reputable source. We post a lot of really great content. If you want to give Indigo a follow on our social media, also our website, we post blogs, and a lot of those include links to, we will kind of source those resources for people, so we reshare and post some good information, educational information, blog posts, things like that. And then there's if you go through the American Physical Therapy Association, through their website, you can find a pelvic health specialty physical therapist, and so you can find someone more local to you as well for a good resource for either education or some in-person assessment and treatment.
Great. I will share all of that on our Facebook group. So go there, Menolife, if you want to get all this great information. Dr. Maggie, I missed a really big one.
Ooh.
What type of lubricant can help with vaginal dryness? I
Okay,
can't believe I left that off.
that's very important to talk about.
Very important. I was like, how did I miss that?
So, okay, yeah, no, it is a good question. So lubrication is great for reducing friction during intimacy.
Yes.
And then there's also vaginal moisturizers. I'll just throw it out there. That can help with vaginal dryness too. You know, a lot of them might contain something like hyaluronic acid that helps draw moisture in.
Yeah.
So that's something you want to use regularly. Lubrication, very important for decreasing friction and making intimacy more comfortable. And there's many different options. So it is good to know there's water-based options are the ones that we often see at the store. There's water, there's silicone, and then there's oil-based ones. And the water ones can actually be worse for you, to be honest with you. So I usually have people avoid it. A lot of the ones that are readily available, that are affordable, that are at the drugstore, have a higher osmolarity. So sciencey word, but basically what that can do is draw moisture out of your pelvic floor, out of your vaginal canal, out of the vulva. So it can make everything drier, which defeats the purpose, right? Long term, it doesn't make sense. So, you know, it does tend to be very slippery water. So the water one, so people really do like it. But if you're going to choose one, you want to look at the osmolarity and you want it to be like closer to around 300. But a lot of the really popular ones are like 1200, 2000, 3000. And that, again, long-term can be very dry. Silicone-based lubes, are a good pH. You don't have to worry about the drying. They tend to be more pricey, so maybe isn't always someone's first choice, but a little goes a long way. And again, it can make intimacy much more comfortable. And then the oil-based lubes, you know, if you like it, that's fine. We tend for the younger generation defer because it can it's not compatible with condoms. But at this stage in our life, it's not really that relevant. Yeah. So it's just kind of like what works best for you.
Yeah. Going back to the vaginal moisturizer, I think I shared this when we went through our run through. I follow someone who said something like to the effect of, you take care of your skin every day with a moisturizer, so you should do the same for your lady parts. And I was like, I'd never thought about that. So just something for everyone to consider. If you don't do it, maybe it's some time that you try. Dr. McCaul, I'm really excited to talk about my exercises. As I shared at the top of the show, I got homework when I went to Indigo Physio, and I've been doing them. I do them after my workouts, and I do them before I go to bed. And I was kind of curious, just for people who don't actually do pelvic floor exercises, how long does it take to see, you know, a difference, to feel a difference?
Yeah. So again, I'm kind of same theme here, but the short answer is it depends, you know, kind of based off of why you're coming to see us and what some of your conditions are. But generally speaking, we recommend starting 2 to 3 times a week of consistency with those exercises. We want something that feels achievable and attainable. That's a great starting point. And then, you know, after about 6 to 8 weeks, we should start to see some really good improvements. And there's just some kind of principles there in terms of like tissue healing and changes to the tissues and muscle components there. Again, there's a little bit more, you know, specificity to that depending on what we think is going on and why you're coming in. And that's not to say you don't see some small improvements. You know, we're always looking when we work with our patients, you know, session to session, we expect some small victory, you know, whether that's a small behavior change that can really yield positive results, but long-term changes closer to the 6 to 8 week mark.
And do you need any exercise equipment with pelvic floor exercises?
Not necessarily. There's some any additional bands and little stability balls and things like that can be helpful. But there's a lot that we can do to get started with just, your body weight, your mind, that mind muscle connection. Those are great, great introductory things that we can do. If you have access to additional equipment moving forward, great. But not everyone does. And so we want to make sure that we can give patients an opportunity to be successful with what they have, and just using, their own muscles and their body.
And speaking of introductory, can you, Dr. McCaul, please share homework with our community to kind of start off with their pelvic floor health?
Yes. So, my favorite thing to start for so many individuals is something called 360 or diaphragmatic breathing. And what that is, your respiratory diaphragm sits at the top of your abdomen, and then your pelvic floor is basically that floor at that bottom. And so you want to think about taking a really nice deep breath in, feel the rib cage, the belly expand. And what that does is it helps to promote some lengthening of those pelvic floor muscles, kind of reconnects with your core, your abdomen, your pelvic floor. There's some really great just relaxation, stress management that comes into play there, which is so important for just general wellness. But it's a really nice tool to start reconnecting with your core and your pelvic floor. It's definitely one that I recommend for many patients, and it can be a great starting point. There's some really great, if you YouTube channels and things like that have some breathing exercises to get started. So again, you can follow along with Indigo. We post a lot of good things like that, some good exercises, but that's a great starting point.
This is one of my exercises. So I do it as a part of my evening routine. I put on my little LED light mask and I sit back and I do my breathing for 10 minutes, and it's really nice, and it's a part of my pelvic floor exercises. So I love it. I love that it's making me slow down and, added it to my evening routine. Ladies, I'd love to end with one item that you guys would add to our peri toolkit to help with the pelvic floor during perimenopause and menopause. Dr. Maggie, would you like to go first?
Just one.
Yeah, I know, just one. I thought we'd just keep it at one.
I have a bunch, so I'll just say one. I'm gonna just say, from my department, the vaginal estrogen is really important.
Definitely. Dr. McCaul.
I'm gonna go with a squatty potty.
Oh yes, so, I do love a squatty potty. We need to talk about that.
And we didn't touch too much on that, but maintaining a healthy bowel routine, healthy bowel movements is so important in supporting a healthy pelvic floor. That on top of the breathing, but if you don't use a little stool to put your feet on for bowel movements, that's also a great starting point.
That's so good to know. Because most people, like me at least, pelvic floor, I just thought of the vaginal area. So it's good to know it's the whole set. We're all working together. So I want to say thank you guys for joining me. This has been really, really great. If anybody has questions, let me just double check really quick. I don't think I saw any questions, but if you guys have questions that weren't answered today, and that if you do have a question, you could ask one still while I'm closing out, but we could please reach out to our customer care team at customercare@menolabs.com, and our wonderful customer care team will be able to help you. Otherwise, I love that you guys were here with us learning about the pelvic floor. Next month, we'll be learning about sleep with a sleep expert during perimenopause and menopause. So we really look forward to that. As always, this session should not be considered medical advice. It is being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. Thank you again, everyone. Have a wonderful day. Ladies, thank you again. This has been so helpful. Bye.
Thank you. Bye.